So for those of you that are joining us, hello and welcome. My name is Brittany Choate. I'm Director of Programs with Saliva Direct, Inc. We are a public health nonprofit, and we work on developing more accessible testing strategies. Our team works to develop and deploy innovative solutions. So we do research and diagnostics, as well as connect communities with on-the-ground testing. And our goal is that by providing more equitable testing and hosting events like this, we're going to be able to better advocate for and promote and advance patient-friendly diagnostic solutions. Today's session is themed around From Classrooms to Communities, Strengthening Health Through Education and Partners. And it's my pleasure to welcome you to this edition of our webinar series. Joining us today are presenters from a couple of different communities and across the U.S. Dr. Nicolette Teufel-Shone is joining us, as well as Mae-Gilene Begay, and they're going to be co-presenting their community university partnership and preparing emerging health professionals to work with Native nations. And we're also joined by Leah Perkinson and her colleague Becky Smith, who are authors and public health leaders who are going to be presenting on K-12 partnerships for improving health and wellness outcomes for underserved populations. I'm very pleased to turn things over to our first pair of presenters. Up first is Dr. Nicolette Teufel-Shone from the Northern Arizona University, Professor of Health Sciences, and Mae-Gilene Begay, who's President of the Forest Lake chapter within the Navajo Nation. They'll be presenting their talk, A Community University Partnership, Preparing Emerging Health Professionals to Work with Native Nations. Please go ahead and start sharing your slides when you're ready.
Thank you so much for the introduction. And Brittany's already shared the institutions that we're both from. Mae-Gilene, did you want to add anything else to your introduction?
Yeah, I just want to add that I'm also a member of the Navajo Nation Human Research Review Board, as well as the Navajo Nation Uranium Remediation Advisory Commissioner. Thank you.
Great, thank you. So the presentation we have today will focus primarily on the work that we've done together in the context of the academic program at Northern Arizona University. We have an MPH program that started in 2018. And I think what's really distinct about our MPH program is we do have a Indigenous health track. And you can see there some of the requirements for the students that elect to enroll or apply and enroll in that track. And one of the real focuses of that track is to provide service learning, in the sense that we want students to get experience beyond the classroom. And this was our first graduating cohort. And you can see that all the graduates that particular year were all Indigenous students here from the Greater Southwest. This idea of having service learning is certainly critical to getting accreditation for a MPH or an undergraduate degree in public health, in which there is a focus on experiential learning. And here at NAU, that's experiential learning is really done in the context of internships, service learning projects. We try to have seminars and other kinds of engagement in ongoing projects that allow students to work with communities, whether that's with Navajo Nation or the other tribal communities that are here in Northern Arizona. We do have relationships really with tribes throughout Arizona. There are 22 federally recognized tribes in Arizona, and we're very fortunate here at NAU that we get referred by the communities we work with here in Northern Arizona, and so we'll get requests from those tribes that are down in what we refer to as the Valley in Phoenix and the Tucson area. So we feel like it's really important for students to work with local health professionals so that they can hear the assets and the challenges that those professionals have when they're working in public health. And when I say professionals, I don't necessarily mean other people who have PhDs. They may be people that are working in community health worker roles, what are referred to as community health representatives. On most tribal communities will have individuals that work with individuals in their households or community-based projects. So we think it's really important that students work alongside those individuals at a variety of ranges in public health. To just give you a little intro into what is referred to as service learning and the fact that it actually is described as being different than just volunteerism, is it the idea that the student is challenged to really reflect on their experiences so that they are seeing their role when they're working in the community as both service, which may look a bit more like volunteerism, but they're really challenged in the context of a course or in a class to think about what they're learning. And oftentimes they're learning that the challenges that may be occurring for the public health professionals or practitioners may be upstream challenges. For example, maybe influencing the amount of financial resources that a program has, whether their clients live out in rural areas, which may require going to their homes, or if you're having community events, how do those individuals come into those bigger social gatherings? So it's really important for them to think about the upstream challenges and assets that people who are working on the ground, the practitioners, are experiencing. And that's oftentimes done in the course of a classroom experience by creating structured opportunities for students to reflect. So you're thinking of asking them a lot about their learning. It's kind of less important what they actually did. If they helped in a senior center and prepared food and helped serve that food during the lunchtime meals that are oftentimes provided at senior centers in rural communities, but more reflecting on, do they have an idea of, who pays for that service? What are the backgrounds of the people that are offering the food service? Do they have a cook that identifies, what meals are provided? Is there a nutritionist, or do they just have to provide meals that are familiar to the elders who may be eating in this elder center, a senior center? So it's really important for them to see what are sort of the assets and the challenges in any kind of situations, but having them reflect on what they're learning. So one of the key parts of the work that we do is engaging with community partners, because if you're going to develop a service learning activity for students, you want to make sure you're serving a need for the community partners. So it's important to think about not only student growth, but also what is a defined program or activity that the students could engage so that it's a benefit to the community. It's not a burden to the community to suddenly have 10 or 12 students descend upon the community. And in doing that with rural communities, as the partnership with Forest Lake and the Navajo Nation, you need to think about what resources are there. So if you do have 10 or 12 students going to Forest Lake, as Mae-Gilene will describe, there's not a lot of resources in Forest Lake. So if you've got people there, you have to think about what they're eating. If they're going to do household surveys with houses that are distributed across the community, what's the transportation like? What is the availability of local staff that can travel with students if they're doing some sort of survey, which you'll hear was key to what the program we're going to describe to you. What do you need? I put in some other things about resources in past service learning activities that we've been involved with. Students may be involved in helping with the community garden. And if you have people doing that, you need to bring your own shovels. You need to bring your own work gloves. So knowing that oftentimes communities are not going to have resources, you just can't run to the local Walmart and quick buy shovels and gloves. The other thing that's really key in working in a lot of tribal communities is translators. In some cases, the service learning activities that we've been able to do with Navajo Nation, we will have Navajo students who may be able to speak Navajo or some Navajo, but oftentimes they are not, don't have the level of proficiency that might be needed to work directly with community members, especially in the administration of a survey. So then this partnership that just recently we worked with Mae-Gilene. Mae-Gilene had to not only go herself and serve as a translator or find local staff that work with her in the chapter house that can provide those translation services. And so that's what we're going to talk to you a little bit today about. As just one case example of working with a chapter. So chapters are local governmental structures within the Navajo Nation. And there's 110 chapters within Navajo Nation. Some of the chapters are pretty large. You might have heard of them, such as Kayenta or Tuba City. Those are larger ones that people who know something about Navajo Nation may be familiar with. Forest Lake is a much smaller chapter and doesn't have as many resources as some of the other places in the Navajo Nation. So this map just sort of illustrates location of Navajo Nation. And then you can see in the middle of the map for Arizona, NAU is sort of there in northern Arizona, and then the farther kind of light brown area to the right is the Navajo Nation. So NAU is pretty close to the Navajo Nation, but Navajo Nation is the size of West Virginia. So it's a big expanse and oftentimes requires travel if you're bringing students from an academic institution into the nation. And then I think this is you, Mae-Gilene. You have to unmute.
The Navajo Nation is divided into 110 communities in the state of, excuse me, Utah, Arizona, and New Mexico. Forest Lake is one of those 110 chapter or local governance. And we have 24 elected officials who serve as our tribal council, and they serve a 4-year term. As indicated, Forest Lake is very remote and isolated rural community, and we have less than 1,000 residents. And then the median age is 61. So that's very evident when we have our community meetings. We tend to have more elderlies showing up at our meeting, and then also more female. And we also have a medium grade level of high school at 74%. And as you can see, the median income is very low, 25,000. So these are some of the issues that we experience on the nation. And a lot of our Indigenous students that don't live in the remote and isolated communities are not very familiar with what happens in some of these communities, as well as the non-tribal grad students that participate in these projects. It is beneficial to them to expose them to what life is on the Navajo Nation. So these students, they encountered road issues during inclement weather when we had snow or either rain, hampering transportation. And a lot of times, if they encounter such weather like that, they would have to walk to the nearest home that has a reliable phone to call for help. And this is the local governance building that's Forest Lake chapter. And so in creating partnership, I had worked with Dr. Teufel-Shone before as a director of Navajo community health worker and outreach program, as well as a chapter president where I served one 4-year term. And when I started my tenure as a chapter president, I realized that the chapter's biggest need of resource was data. We didn't have any data. So it was difficult for the chapter to request for funds as we were unable to confirm those needs. And this is where the need for partnership with NAU started. So I traveled to NAU to the graduate class to introduce myself as well as the community so that the students are immersed in what to expect when they come to the Navajo Nation, the community of Forest Lake, and then how long it will require them to travel, and then which route is better than the other route, depending on the weather that week or that day. So discussion had to happen with the community people and NAU. Community people indicated some of the needs for the data that should be gathered. So based on that, there was a class activity that was developed, and I can have Dr. Teufel-Shone go into detail on the class activities.
Right,
Dr.
thank you.
Teufel-Shone?
Okay, thank you. So the basic of this particular partnership, we worked with students, Mae-Gilene and Mae-Gilene staff worked on a survey that would help address the data collection needs of a needs assessment. The key was to get the students in the communities paired up with a staff member so they could do the in-person household surveys. And then once the surveys were collected, and it's been several iterations, we keep collecting data, the students will then present back to the members of the chapter so that they can see the data that's being collected, and they can also comment. Does this seem like sort of what's called a member check to sort of see if it seems to resonate with what the community members themselves know about whether there's running water, electricity, whether people have access to services in the community. This just sort of demonstrates that when the students went back on one occasion to provide an overview of the outcomes, it was during Thanksgiving. And so that was a great time to do some feedback to the community because the chapter house hosts a Thanksgiving dinner. So the students could come back. They ended up helping with serving the meal, and then they could provide an in-person presentation to the community, and they could answer questions. And fortunately that year, many of the students were Navajo, so there was that ability to sort of get the students to engage with the community members. These are just kind of a wrap up of service learning, making sure that the students see themselves as learners and listeners first. And then as they work with community members and talk about their own experience as emerging public health professionals, that they can bring some of the skills that they're learning to the community members and to community leadership. And I wanted to highlight the very end of this slide, emphasizing the need to develop a relationship with the students and the community members and community leaders. As I mentioned, many of them were Navajo. So in Navajo culture, when you're introducing yourselves, you share your clans and you can sort of demonstrate it identifies your relationship with other Navajos. And so you can sort of demonstrate that, you know, there's a relationship, there's a relatable experience there. I think the next thing we wanted to, Mae-Gilene, before I go off this slide, did you want to say anything more about the relationship with the students?
Yes, I wanted to stress that trust is very important. So anytime you want to administer a survey, they trust community health representatives the most. And then since a lot of participants were Navajos and that they speak their own language, so trust was established immediately. Thank you.
Thank you. And the last thing we wanted to cover, because we thought it might be of general interest to this audience, is a brief overview of data collection and research with Native nations. So I'm talking generally here, but at the end, sort of we'll zoom back into Navajo. And the idea that getting tribal approval is really recognizing the authority of tribal sovereignty, that because tribal councils have the oversight and the of their citizens within their nation, that each tribe has a system for approving any kind of data collection, and this will vary by tribe. Navajo Nation is one of the 48 tribes that has a institutional review board, and you can see there at the bottom of this slide was the very first tribal institutional review board that was established in 1996, and Mae-Gilene is a member of the Navajo Nation Human Research Review Board. And specifically, if you're interested in working with Navajo Nation, because they have a well-established review board, there is actually a link that you can go to that will describe the steps that you need to go through to develop documents that can be reviewed by that board. So I think that's our last slide. And Mae-Gilene, did you want to add anything as a member? Okay.
You covered it all, Dr. Teufel-Shone. Thank you.
Thanks. So that's it for us.
Beautiful. Thank you so much for capturing that nice case study and offering so much insight into the timelines and the fact that it was over 3 semesters that you were building this and that you were doing it in partnership with the community. It was really lovely to get to hear that complete story arc of the program and remind us all that these kinds of programs and partnerships really do take time to build and establish that trust, as you identified as being a really critical piece for making sure it's valuable, not just for the researchers and the students, but also for the community that you're trying to work with. That last slide in particular is actually a really great segue into a couple of questions that were submitted before we got started with the webinar. So I'll go ahead and jump into those. While we're going through these questions that were shared before, if any of you would like to ask questions directly during this live Q&A time, please remember to use that Q&A option in the lower right-hand corner of your screen and submit those questions on through. And then I or one of the co-presenters will be able to read those out. So the first question that came through in terms of the ones that were submitted before we got started is, how can scientists gain a deeper understanding of the Navajo population? Are there training workshops available to help scientists communicate effectively and collaborate with the community?
Mae-Gilene, do you want to, how someone can prepare themselves to work with the Navajo Nation if they haven't previously worked? You have any thoughts?
I think it's best if they have worked with the Navajo people, and some of those students, they have parents that have worked with the Navajo Nation, so they kind of already know the Navajo Nation government, as well as visiting the local chapter houses where they understand how the tribal government is set up.
And to answer directly, I'm not aware of any workshops. One resource that might be available is the Navajo Nation Health Human Research Review Committee does every other year host an annual research conference. And it might be, if someone is thinking, I would like to better understand how researchers work with Navajo Nation. A lot of the researchers now are Navajo, but everybody has to build partnerships and go through the same process for the Institutional Review Board. It would be great to go to that conference because you'll sort of hear what's going on. You'll hear other ways that people built partnerships, how they kind of collaborated to come up with an area that they were going to work on together.
Thank you. That sounds like an amazing resource to look into. I'm definitely going to be jotting that one down.
Look on their website. Go to that Navajo Human Research Review Board website because it'll start providing information about that conference.
Perfect. And I'll make sure that that website gets included in the follow-up email that Victoria is going to get sent out, so that way it gets shared around with folks that are joining us. Another question, I should say, since there's a few that came through that got submitted, is how is trust being built in the community? What has been or is being done to encourage confidence in the science and safety of the tests that are offered and of programs that are seeking to provide healthcare for the population?
So there's a lot of research that has occurred on the Navajo Nation, and some of those, the results of those researchers were never disseminated back into the communities. And some of the participants of those research were never fully informed about the outcome of any tests that were done in their home, collecting air, water sample, and so forth. And for that reason, there's a lack of trust. And but the CHRs, they live in the communities, so the communities, community members, they really trust the CHRs. And what Dr. Teufel-Shone's students, being that they're indigenous students, so they already knew that these students would trust them with not hesitating any information. The full information was shared back with them.
That's really physically going back and talking about the work while it's going on. A lot of times what academics will do, they'll get permission, they'll do their thing, and then they come back 3 or 4 years later. No one can even remember what they were doing. And so I think coming back and providing updates on what you're doing, reinforce that you are working, if you are with CHRs, the community health representatives, or with students, and part of this work is creating experiences for Indigenous students so they're better prepared to come back and work in their nation. Those are all really key pieces that can contribute to trust, but showing up is really critical. Not to think you're going to get this all done with Zoom calls and conference calls.
Absolutely. Absolutely. And there's so much to be learned from those roadside experiences that you were showing those pictures of, right?
Right.
Not only about how to effectively engage the community, but about what that community is experiencing. What are some very real barriers that they're having to navigate every day?
Right.
Mae-Gilene, I saw you take yourself off mute. Was there something you wanted to add?
Yeah, I was going to also add that I totally forgot. So in Navajo culture, we always identify ourselves through our 4-clan system. And with the Navajo graduate students that came to our community, they shared their clan system. So right away, the community people, oh, she's my daughter, she's my grandchild, or something like that. So that kind of relationship was established. And based on that, that just increased the trust within those students that came to the community.
Absolutely. Absolutely. Having that shared connection and demonstrating your buy-in and why you're there and how you're wanting to help and that you're a part of the process and inviting people in. That's a beautiful experience that we were able to give those students and a meaningful research project on top of it all. I think we've got another question that came through, but I want to be respectful of time, so maybe we'll save that one for you guys at the end of the talk and shift gears over into our second set of presenters. For those of you that are just joining us, our next presentation is from Leah Perkinson, and she's joined by Dr. Becky Smith. They are co-authors with Rutledge Taylor and Francis Group and both public health leaders. They're sharing with us today about K-12 and public health partnerships, lessons learned from COVID-19, and actions we can take today to keep kids in school and learning before, during, and after public health crises. And it looks like your slides are coming through, Leah, so go right ahead.
Great. Okay. Thank you, Brittany. And thank you to our colleagues who presented before us. It's a really great kind of on-ramp to our discussion, which is really about relationships and building trust, and that partnerships are based on very specific actions. And when those actions are in place, we can expect better outcomes for students in K-12. So with me, so basically this presentation, we're going to give an overview of the book, why it should matter to you, and then we're going to give you some examples of where diagnostic testing shows up throughout the book. But before that, I would like to introduce to you the co-authors of the book, and I'll let my colleague Becky introduce herself, but my name is Leah Perkinson, and during the pandemic, I worked at the Rockefeller Foundation and Brown University School of Public Health, uh, doing a lot of pandemic response work. We also have as a co-author Dr. Lisa Barrios, who is the director of a newly formed division at the CDC, which is the Division of Readiness and Response Science down in Atlanta. And Becky, let you introduce yourself.
Sure. So my name's Becky Smith. I'm an associate professor of epidemiology at the University of Illinois. And during the pandemic, I was tasked with developing a way for our on-campus developed test to be used in schools. And so I got into school-based testing research, which led me down a number of paths.
And one of those is writing this book with us. So,
Yes.
and then we have Dr. Rachel Rogman, who is also at the University of Illinois, Urbana-Champaign. She is an associate professor in the Department of Education Policy, Organization and Leadership. So, Becky, can I ask you to kind of lay the groundwork for how all four of us from these different organizations came together?
Yes. So I met Leah when the University of Illinois said we have a test we'd like to try out in schools, and Leah was the program officer with Rockefeller Foundation, giving us the funding to pilot saliva-based testing in schools, which, as Saliva Direct knows, there was a lot of questions early on in the pandemic. Can you safely test school children using a saliva-based test? Can you ask kids to spit safely during a pandemic? So we were given the funding to do that pilot, and the pilot worked so well that our governor of Illinois said, okay, we're going to fund saliva-based testing in schools retroactively, and gave us back all of the money. So we said, well, what do we do with this money? And we decided that we needed to really bring together what we learned through the pandemic about all of our K-12 response. So many people had been working in so many groups. Leah had been leading the Cross-City Learning Group, which was a group of a number of us who had been working in school-based testing. And so we brought together this whole group at the symposium in November of 2022 to talk about what worked, what didn't, what we could learn moving forward, and really how we made these partnerships work. And we wanted then to document what we were learning in the symposium and discussed a number of ways to go about it. And that's where Rachel and where Lisa joined us. Rachel being an education professor and was familiar with the field of educational policy, and Lisa being with the CDC working in school public health partnerships. So the four of us came together to document everything we learned through the symposium and then through follow-up interviews to present this book as basically something that will be there, physical, can pull off the shelf. So in the future, when a public health crisis happens that may affect schools, we have documented evidence of what works.
Right. Yeah. Thank you, Becky. And attending this symposium, so it was just pretty special for a lot of the attendees. This is 3 years ago. The pandemic is barely over. We're still having a difficult time. And guess what? Here comes University of Illinois offering to pay school nurses to come to Chicago to share their experiences so that it could be included in a document that could be shared with others to help them, get a head start when another public health crisis starts. So I can't underscore enough the importance of University of Illinois Urbana-Champaign using that funding to bring together not your heads of NIH and CDC and so on and so forth, but the boots on the ground. This is really special to them. So As Becky shared, we wanted to elevate some of the lessons learned from on-the-ground work. What made these partnerships between K-12 and public health successful to the point that they enabled our schools to open and our parents to go back to work? Like, what was it? What's that special sauce? You know, we might be able to just say it off the top of our head, but we want to put something down in writing for our future public health and teacher leaders. We had 95 speakers from 39 states, and what this book represents is really their experiences. Hold up here, let me go to, I'm trying to get to our frame here. Okay, so our framework, this right here is how our book is organized. So we've got 5 chapters total. And within these chapters, basically are 2 bookends, right? We've got the intro and then the conclusion. Our ideal reader for this book, our primary audience is K-12 future teachers and leaders. So these are students in 4-year preparatory programs. Our secondary audience is public health students, so folks in the public health and medical fields. And then our tertiary audience, I think, is a lay audience. So these are parents who are interested in knowing a little bit more about, okay, what is testing in school? We wrote this to be digestible and relevant for people that are, you know, not experts in diagnostics. So we've got these 3 chapters in between our intro and our conclusion. And these are really bubbling up our 3 pillars of effective partnerships. So we've got, in order to have effective partnerships between K-12 and public health that keep kids safe learning and in school during the next public health crisis, we want our partnerships to be built on trust, a commitment to equity, and effective communication. So that's it, kind of simple, and nothing new or ground, earth-shattering here. But this is what we heard from the leaders who were doing the work, and we wanted to capture it. So let me move forward with this. Okay, so just kind of to recap, the value add to our K-12 and public health readers. So this is a book that includes examples and case studies about how K-12 and public health leaders partnered during the pandemic to keep kids safe, really how we open schools. So what? So we include recommendations about how to build effective partnerships that our public health and K-12 leaders can take today to keep kids safe tomorrow. Okay, so what next? So our hope, like this is just one of our hopes, is that preparatory programs that are preparing our future public health and teacher leaders to be in the K-12 and public health space, we hope that they might incorporate this book to give these future leaders a toolbox for building effective partnerships. It's not the end all be all. It is not an encyclopedia, but it is what we learned. And so more specifically, the value add for you on this call, we include a lot of cases and examples that focus on screening and diagnostic testing. So what? Like, why should we care? Why should you care? I feel like the book helps to normalize screening and diagnostic testing in school, which is a big deal. Considering nobody even knew what a screening or diagnostic test was 5 years ago. What next? Well, this is a question for you to consider as we highlight the examples of diagnostic testing that we include, which we're going to do in the next couple slides before we finish up. So what next? How could you use this book? Like, how could you use it? We'd be curious to know. And then we'll invite any reflections or feedback. So first, apologies for the text-heavy slide, but we'll only take a few minutes. And actually, Becky, if you do not mind, what we did here in the next few slides is provide some examples of where testing shows up. Becky, would you mind sharing this this reflection from Superintendent Dr. Robert Maychek in Illinois?
Yes, thank you, Leah. Dr. Robert Maychek, in his school district in Illinois, they were one of our partners with the University of Illinois' saliva-based testing program, the SHIELD PCR test. And he talks about how important the role of community partners in keeping schools open and partnering with public health to track cases, partnering with the university to develop the test and to have access to the test. They were able to have testing available to every student and staff member weekly, averaging 3,000 tests a week. And that allowed them to open schools safely and to give them, parents and students and teachers, a feeling of safety coming back to the schools. So that sort of example was just exactly what we were hoping to do with the SHIELD Illinois program, and what Leah's initial funding allowed us to pilot, and allowed us to really build this program that led to this book.
Thank you, Becky. And, you know, we are unabashedly positive in this book. We are not, and we're okay with that. These are a bunch of success stories. We know what didn't work, and this is a list of what did. One of the case studies, so the case studies are where we do a deep dive on either trust, equity, or communication, and situations where that worked. Why, who was involved, and like what the backdrop was. So with our Alabama case study, gosh, we talk about how the University of Alabama School of Public Health partnered with Birmingham City Public Schools. Birmingham Public Schools, there is, well, just in Alabama altogether, I can remind you quickly of the Tuskegee exploitative study that happened, the syphilis study, where even though there was a cure, participants were denied treatment, so they died often painful deaths, them and their family. These were African Americans. So we set the stage, but you know, this is one example of where, you know, the university, this ivory tower that represented public health, was not trusted. And it was, you know, a trust that was earned, a mistrust, I'm sorry, that was earned over time due to exploitation. So we get into that. It's complex. There's a lot to unearth. We don't get to all of it, but we do describe how the school district and the School of Public Health worked together, worked with their community, and made some progress, and was able to rebuild, however much, just enough to get their school community to participate in testing and in vaccinations. So what you see right here is our superintendent in this left-hand corner. And then, of course, our, I don't know, 5 or 6 year olds over there. So and the cool part, I don't want to like take all of our time, but I did include this slide because, okay, faced with, let me read this slide to you. Faced with rising case numbers and low participation, the University of Alabama testing team knew that doing more of the same would not be enough. So they paused, reached out, and asked school communities in Alabama directly, what would make this work for you? The answer was clear. They needed resources. And this began the beginning of a new chapter in their testing program. So beginning in the fall of 22, every district if at least one school building offered testing, that district would receive $40,000. The schools would get $15,000 for holding at least one testing event. And each schools in these largely underserved districts, each student would receive $15 gift cards each week that they tested. So, you know, we are not implying, we do not say, and we address this issue specifically, we're not, bribing people to do stuff. It's a very, you really have to be thoughtful, okay, and engage with the community every step of the way. And I think this case study does a good example of that. So this is an example of where incentives worked. This is a success story of how that 10 billion from Biden, where it went, how it helped. Anyway, another success story about testing. Let's move to the next one, and maybe we'll have maybe one or two. I don't know how much more time we'll have, but Becky, would you like to read this reflection from somebody we all know well, Dr. Ann Wiley?
Yes, and I feel a little strange talking about this example in front of Brittany and Victoria and the rest of the Saliva Direct team. But Dr. Ann Wiley and her team at Yale built Saliva Direct because they knew that testing was needed. And they really emphasize the need for trust. It's not based on scientific innovation, but deliberately creating space to hear concerns and using those concerns to inform decisions. So the Saliva Direct test is a success because it was built on a foundation of prioritizing listening to partners and building those partnerships through listening. And one of our foundations of trust is really listening.
And I think that really echoes, thank you, Becky, for that. Our colleagues who presented before, talking about, needing to learn and listen before teaching. I think we provide a very similar kind of takeaway. You got to listen and learn before teaching and leading. And we've got two more quick examples. Becky, I'm going to talk about New Orleans, and then quickly about Kentucky, and then we will close. So in New Orleans, this is, I think maybe some of you have worked with charter schools before. In New Orleans, they are all charter schools. They are public charter schools, but it basically means they have their own school board, each one of these schools. So it is a lot to get anything done. Anyway, New Orleans, a very similar situation in terms of the percentage of students on school free and reduced school meals. This is a student population that gets the majority of their health services from the district, and this is why it was so important to offer school-based health services, including testing and vaccinations to these kids. Dina, I'm going to read this quote real quick. She's saying, look, we had to create as many partnerships as possible with local health department and hospitals to bring testing into parts of the city who typically don't get these resources or support quickly. And they knew where these spots were. Eventually, we were also able to offer testing at school sites, open it to the community. It led to an increase in community trust and public safety. And she also says, move fast and find your own solutions, which you'll see that as a recurring theme in this book. And the last one that I'll quickly touch on is Jefferson County Public School. They were on the on-ramp to doing testing, they were kind of, what is the right word? The caboose. And they were part of the Cross-City Learning Group that Becky talked about a little bit earlier. They went from testing 5 per week in, oh gosh, I can't even remember. I want to say November of 2020 to 25,000 a week. 6 months later. So that is a true success story. So anyway, uh, you know, Becky, I'm going to invite you to share any final thoughts after I pose a question to the audience. Not necessarily to answer now, but are there ways that this book could potentially be useful for you, besides having it be a tool to help socialize diagnostic testing in school-based settings? And Becky, let me take my slides off here and invite you to share any closing thoughts.
I'll just say thank you to Saliva Direct for inviting us to come talk to you about this book. You were definitely partners and are featured in the book, and so we appreciate this opportunity.
Well, we really
Thank you,
appreciate you
Becky.
guys having the platform to be able to share it out with more than just those of us that were involved in the writing. And I can't believe it's almost been 3 years since that meeting out in Chicago. That's an astounding statistic. I'm a little in denial. But I think that your presentation did a beautiful job of illustrating a number of examples from the COVID times and also with K-12 partnerships, just as the previous speakers did, as you noted, of building trust and those pieces that are really continuous no matter what population we're working with, finding commonalities, finding ways to communicate and invite them into the process, and making sure that we're doing things as collaboratively as possible is so important to be building something that's going to be received and that's going to actually be utilized by that community that we're trying to help. We do have a little bit of time for questions, so if anyone wants to submit those through the Q&A, please feel free to. I've had a couple that came through beforehand and during the chat, actually. So since we've got a little time, so Leah and Becky, these are to you. The first one, feel free to punt, is with the current climate, what do you think can be done to encourage confidence in testing for school-aged children? I think that's a reference to a political climate.
It is hard. I have to tell you that I'm currently designing an infectious disease epidemiology class, and it is really hard currently to do that. But I will say, thankfully, local and state public health leaders are doing the absolute best that they can, and really, although we appreciate our help from the federal government and from CDC throughout the pandemic, we really prioritize in our book partnerships at the local level. State and federal guidance is helpful, but really these local partnerships were the basis of a lot of these K-12 responses. So state and local partnerships are really the key. And once those build, you have good guidance from the state and the local people.
Yeah, definitely. Definitely. There's another question that came through specifically to the book itself, where there's a curiosity if there's going to be a digital component to the book. So that way it can be not necessarily literally on a shelf, but available in a digital format, or maybe even one that gets updated every once in a while, recognizing that takes funding and resources and things like that. But just curious about the platform.
Yeah, I'm not sure about an ebook component. I will say that there will be online appendices with practice questions, with study guides, with actual exercises that classes can do or that people can do to practice some of what we've talked about, and a lot of links. We have an incredible list of resources, other places to go look for more information. So all of that will definitely be available online.
Those kinds of evergreen resources and being able to find them digitally is going to, I think, be a big help to folks like myself as well as others that are going to be hopefully utilizing this resource. And then the last question that I think we've got just enough time to pop over to is, in general, what would you recommend for folks looking to do K-12 partnerships? How can they encourage testing in schools and in the broader community? If there's one big takeaway or maybe one or two, what would you say?
One
So-
thing I would say is start before you need it. Get yourself on those community boards, give something to people. Don't, give something of value. It may not be financially, but intellectually, your expertise, give freely, and then, build on that. Becky.
Yeah, I was going to say almost exactly the same thing. And we talked a lot during the pandemic about building the plane as we were flying it. Build the plane now. Do the groundwork, and we have a lot of guides to that in the book of how to do the groundwork to start making those partnerships, start reaching out, building the relationships, starting from individual relationships up to institutional partnerships. It takes time, it takes listening and real active listening and communication to build that trust and that relationship. And so the best time to start is yesterday, but if you haven't started yesterday, then start now.
That's a beautiful way of tying it together. And I think a great link to, again, that previous talk that we had about taking the time to build those relationships, recognize that when you've got funding or an opportunity comes around or there's a health crisis, it's a little late to be going and approaching and saying, how can we help, if you don't know who to talk to in the first place, or they don't know who you are and you don't have that trust that's already there. That's a really challenging place to be operating from. So taking advantage of this lull, at least a little bit of one maybe, to build and to get those relationships going, I think is a really lovely reminder and a great note for us to conclude today's webinar on. I, again, really appreciate you all taking the time to join us and be a part of this. Those of you who joined us live, those of you that are going to be watching this as a recording later on, really appreciate Nicolette Teufel-Shone, Mae-Gilene Begay, Leah Perkinson, and Becky Smith for sharing your expertise. For those of you who are interested in offering a little bit of feedback, please click on the link. It's also going to get sent around through Victoria's email. We love to hear what people think about these presentations and suggestions for who else we should be inviting into the conversation. So feel free to take a moment. It'll just take, I think, literally a minute, unless you're really detailed in your thoughts about the process to complete, and that'll help us understand how effective these are being. And then lastly, for those of you that are interested in receiving PACE credit, those certificates will be available a little bit after today's session ends. Got to give our system a little bit of time for those certificates to be generated. But if you don't see one associated with your profile in the next day or two, please feel free to email myself or Victoria. We'll be more than happy to connect those with you. And so finally, that email is going to get sent out by Victoria with the recording of today's presentation, a link to the survey, and then any other links that our presenters want to share over our way. We're happy to share those out with everyone who's registered, so that way those resources continue to make their way out into community. So really appreciate you all joining us, and we look forward to seeing you at a future Saliva Direct event. Thank you all.
Great. Thank you for the invitation.